24 hours, we have identified 838 new cases of COVID-19 and completed about 2,500 tests. Our positivity rate for lab-confirmed cases is about 33.9%. Turning to hospitalizations, there are currently a total of 1,538 people with COVID-19 in hospital, including 123 in the ICU. Sadly, 14 new deaths were reported to Alberta Health over the past 24 hours. While I know we are all tired of hearing about COVID, the reality is that it continues to cause severe outcomes, and it is important that we factor this into our daily routines. My condolences are with the loved ones of the people who have died, and with anyone in Alberta who has lost someone important to them, no matter the cause. As of today, only 2 of the more than 2,500 schools in Alberta are in temporary at-home learning to address operational challenges. Alberta Education will continue to work with school authorities on school shifts to at-home learning. It is encouraging to see a continuing declining trend. Less than 0.1% of schools are now on temporary at-home learning. School authorities continue to have the flexibility to shift a class or an individual grade to short-term at-home learning to address operational challenges at schools if needed. As the Minister mentioned, vaccine appointment bookings open today for 3rd doses in the primary series for children between the ages of 5 and 11 who have specific significant immune-compromising conditions, and 3rd dose boosters for youth aged 12 to 17 who have underlying health conditions or are First Nations, Métis, or Inuit. As well, adolescents between the age of 12 and 17 with immunocompromising conditions can now receive a 4th dose booster to help increase their protection from COVID-19. If you were wondering if your child is eligible for an additional dose, I encourage you to review the list of conditions at alberta.ca/vaccine or speak to your healthcare provider. Appointments can be booked online or through the Alberta Vaccine Booking System or by calling 811. The province is now in a period of transition as we begin to shift from a pandemic response to an endemic one. This is a shift all provinces are undertaking. As the Minister mentioned, a joint statement by all Chief Medical Officers of Health across Canada was issued yesterday, highlighting the beginning of a move across the country to transition towards an endemic phase of COVID-19. After nearly 2 years of requirements to modify the way we have lived, worked, and socialized to help reduce transmission of the virus and protect each other, it's going to take time and effort to adjust away from mandates and towards personal risk assessments and actions. For some Albertans, this transition will seem quick and easy. For others, it will be much more challenging. And for many people, it will likely be somewhere in between. There is no one right way to respond to these changes, so we should expect different responses. Every person's experience through the pandemic has been unique, depending on the challenges they have faced. COVID risk to individuals and the population is not a binary on-off or yes-no state. Some people will continue to be at high risk individually of having a severe outcome should they be infected. As a population, we will continue in the short term to be impacted by the COVID patient load on hospitals, which is being managed capably by healthcare teams, but is not yet back to a baseline state. Also, both as individuals and together as a population, we have all had impacts in our lives from the protective measures that have been necessary to use throughout our various waves. As we move forward, it will be vital that we find a way to respect each other's previous experiences, comfort levels, and risk context, different as they may be from our own. This includes seeking to understand and provide space for actions of others, especially if they are taking different precautions than the ones we are taking. I particularly want to thank parents and educators for their work to support our kids to make a transition to a masking optional school approach that started yesterday. This change is hard, and our kids need us to support them and to model how to respect others despite differences.